the channel Dr.SNA, which is Saniaandaamer. For the people who are watching and haven't subscribed to our channel, please click on the description button below. In this way, you will be updated with our new video every week. Also follow us on Facebook, Twitter and Instagram. Link is in the description below. Also give your valuable comments and suggestions in what way we can make our video better. Today I am going to talk about HIV and AIDS. According to the United Nations program on HIV, about 37 million people were affected with HIV and AIDS in 2014. HIV encompasses every country, but several sub-Saharan African nations have been hardest hit, including Swaziland, Lesotho and South Africa. HIV and AIDS are not the same thing. However, it is important and helpful to know the difference between them. So let's start. What is HIV and AIDS? HIV is human immunodeficiency virus. HIV is of two types. HIV-1, which causes almost all cases of AIDS worldwide, and HIV-2, which causes AIDS-like illness. HIV is a virus that attacks immune system, which is our body's natural defense against illness. HIV destroys type of white blood cells in the immune system called T helper cells and make copies of itself inside the cell. T helper cells are also referred to as CD4 cells. As HIV destroys more CD4 cells and make more copies of itself, it gradually breaks down the person's immune system. If someone living with HIV and is not receiving treatment will find it harder and harder to fight off infections and diseases. If HIV is left untreated, it will take 10 to 15 years for the immune system to be so severely damaged that it cannot defend itself at all. However, the progression of HIV depends upon age, background and health. AIDS stands for Acquired Immunodeficiency Virus Syndrome. AIDS is not a virus, it is a syndrome or symptoms caused by HIV. The person is said to have AIDS when their immune system is so severely damaged or it's so weak that it cannot defend against infection and they develop certain defining illness or symptoms. AIDS is a large stage of HIV when the infection is so advanced that if left untreated will lead to death. So what causes HIV? HIV is caused by human immunodeficiency virus. You can get HIV with contact with infected blood, semen or vaginal fluid. You can, most people get HIV infection by having unprotected sex with someone who has HIV. Another way of getting HIV is by sharing needles with someone who has been infected with HIV. The virus can also be passed from mother to baby during pregnancy, birth or breastfeeding. So what are the symptoms of HIV? The symptoms vary from person to person. There are three stages of HIV. Number 1, acute illness. Number 2, asymptomatic period. And number 3, advanced infection. The first stage is acute illness. The most common symptoms in this stage are number 1, body rash. Number 2, fever. Number 3, sore throat. And number 4, severe headache. Less common symptoms in this stage are number 1, fatigue. Number 2, ulcers in the mouth or genitals. Number 3, muscle aches. Number 4, joint pain. Number 5, nausea and vomiting. And number 7 is night sweats. In this stage, the symptoms last for 1 or 2 weeks. The second stage is the asymptomatic period. After the initial symptoms disappear, HIV may not cause any other symptoms for months or years. At this time, the virus replicates, begins to weaken the immune system. a person at this stage won't feel or look sick, but the virus is still active. They can easily transmit the virus to others. This is why early testing is very important. Now the third stage is the advanced infection. After this, HIV will progress to the third stage, which is referred to as AIDS. In this stage, person's immune system is so damaged that he or she is susceptible to opportunistic infections. Opportunistic infections are the condition in which the body would be normally be able to fight off but can be life-threatening. The symptoms in the third stage are number 1 nausea, number 2 vomiting, number 3 persistent diarrhea, number 4 chronic fatigue, number 5 rapid weight loss, number 6 cough and shortness of breath, number 7 recurring fever, chills and night sweats, number 8 rashes, number 9 prolonged swelling of the lymph nodes in the armpits, groin or neck, and number 10 is memory loss, confusion or neurological disorders. Now after these symptoms, a question arises that is HIV or AIDS curable or not? The answer is no. There is no cure for HIV and AIDS yet. However, there is a treatment can control HIV and enable people to live a long and healthy life. If you think you've been at a higher risk of HIV, it is important to get tested to find out your HIV status. Blood test is the only way to know if you have the virus or not. If you've already been for a test and your result came out positive, you will be advised to start a treatment straight away. Treatment is the only way to prevent HIV from damaging your immune system. It also reduces the risk of passing HIV to your sexual partners. How HIV is diagnosed? Your healthcare provider can diagnose HIV by testing blood for the presence of antibodies, which is disease-fighting proteins. It may take HIV antibodies for as long as 6 months after infection to be produced in large enough to show up in standard blood tests. For that reason, make sure to talk to your healthcare provider about follow-up testing. How HIV is treated? The standard treatment for HIV is a combination of medicines called antiretroviral therapy or ART. ART medicines slow the rate at which the virus multiplies. NIH and researchers have developed drugs to fight both HIV and its associated infections and cancers. In combination with early detection through HIV testing, available HIV therapies can greatly extend years and quality of life and have resulted in a dramatic decrease in AIDS death in the US. To monitor the HIV infections and its effect on your immune system, a doctor will regularly do 2 tests. Number 1, viral load, which shows the amount of virus in your blood, and number 2, CD4 plus cells, which shows how your immune system is working. How to prevent HIV? Because there is no cure or vaccine to prevent HIV, the only way people can prevent infection is to avoid high-risk behavior, putting them at high risk of infection, such as having unprotected sex or sharing needles. NIH urges everyone ages 13 to 64 to get tested for HIV as a part of their routine health care. Catching HIV in its early stages can make a life-saving difference. With this, I end my video. Thanks for watching. Please give thumbs up and give your valuable comments. Also subscribe to our channel, which is Sania and Amir. In this way you will be updated for our new videos every week. Also follow us on Facebook, Twitter and Instagram. Link is in the description. Also go watch our previous videos. Until my next video, bye.